Good day, everyone. I am Roxanne Claire Bonilio, a student nurse from Biliran Province State University. So I am here to conduct an assessment of a newborn, and the purpose of this assessment is to detect disabling condition as early as possible. So first thing to do is to prepare the materials needed in this assessment. So I have here the gloves, the bulb syringe, the pen light, and the thermometer. So before anything else, make sure that the baby is in a safe place. So our baby is in the safe place already. So now I will verify the newborn by looking the baby's wristband and match it to the mother's wristband. Then prepare the bulb syringe, and now I will instruct the parent to how to use this bulb syringe. So the purpose of this bulb syringe is to clear the airway of the infant, and also to remove the mucus inside the mouth or in the nose. Press and then release. And to the nose, press and then release. So this time, I am assessing the level of consciousness of the baby. I will put on my gloves to make sure that you are free from any bacteria. So I am done putting my gloves, and then I will check the baby's heart rate and respiration. Using this bell on this stethoscope to check her heart rate. So after getting the baby's heart rate and respiration, I will check the suture lines of the baby by running over my hands to her head. So this is to assess the baby's head shape and also to measure the newborn's head circumference. Okay, so next is to inspect the baby's eyes. Lay the newborn in a supine, and yes, she is now in a supine position. And now I will check her eyes using this pen light. It's normal, and so now I am done inspecting the eyes of the baby, and now let's move on to the ear of the baby. By inspecting the ears of the baby, it should be lined sa iyang eyes and drawn from the inner canthus to the outer canthus of the eye and back across the side of the head. So let's move on to the inspection of the infant's nose. So I will test for the conal atresia by closing newborn's mouth and compressing one nares of the infant at a time with your fingers. So now let's inspect the mouth of the baby. It should be open widely, and when the baby cries, inspect the palate of the infant and to be sure it is intact. So, I am now observing the sucking reflex. So now I am done checking the mouth of the baby, and let's proceed checking her neck by rotating her head slowly. And let's move to the chest of the baby. Also, I will inspect it for discoloration. We'll also inspect the abdomen of the baby, down to the base of the cord. If there's no bleeding present. So to finish the abdominal assessment, I will be palpating the infant's abdominal, each quadrant, to know if where the umbilicus moves. So now I will be inspecting the upper and the lower extremities for testing the upper extremities for muscle tone by unflexing the hand of the baby approximately 5 seconds. So I will now hold the hand of the baby to count her finger. Down to the lower extremities. I will also check the finger of the baby in her feet. So far, it's normal. And then I will check the baby's genitalia. And my baby here is a girl. And I will check her vulva. Okay. And now I will check the spine of the baby. Slowly tilt her body to check her spine. And then lastly, I will take the baby's temperature under her armpit. Baby, are you okay? So in every assessment, there should be an document findings. Okay, I am done on my assessment. I am done documenting the findings, and lastly, do aftercare. So that would be the end of my assessment. Thank you for watching.